The most effective way to identify the people at risk of heart disease and diabetes is to consistently and systematically assess eligible people and ask everyone about their smoking status during normal consultations. Of course, it's important to concentrate on the reasons for their visit, but using the tools available and making the process attractive for patients, there is a lot you can do. So you can reduce your risk of heart attack or stroke by not smoking. People love stories they can relate to. They think, yes, that's me. You might need to wait for results to come back to calculate cardiovascular risk, but you can always discuss those results at a later consultation or by the phone to follow up. I'll be wanting to catch up. At a minimum, for eligible patients, always record a person's blood pressure, blood lipid levels, blood glucose levels, and smoking status. And always use the same read codes, tabs, and fields in your patient management system when you're inputting data. If you're unsure how to do this, discuss the options with your PHO or your IT vendor. To make your life easier on a day-to-day basis, appointment scanners, prompting tools, PMS data entry shortcuts, and the Heart Foundation Your Heart Forecast tool can be very helpful.
A good way to remind yourself about who needs cardiovascular risk update or who might need advice about smoking is to review your appointment list each day. Check if your patient management system has got an appointment scanner function that will allow you to bring up cardiovascular and smoking fields to help identify who needs risk assessment that day and who might benefit from smoking cessation support. By running a scan, you might, for instance, identify that 5 of the 30 patients you're due to see in a day have important information missing from their records that prevents you from assessing their cardiovascular risk, like a recent blood lipid or an HbA1c test, an up-to-date blood pressure measurement or smoking status. By knowing the information gaps in advance, you can factor these into an appointment before a patient even enters your consultation room. You can also set up an additional reminder for yourself in your waiting room pop-up window just before an appointment. My admin team do this function for me. They run the appointment scanner first thing in the morning, late morning and early in the afternoon.
A prompting tool is the most effective way to remind you to assess a patient's cardiovascular and diabetes risk and to input the relevant information into your practice management system. I always have a prompting tool open alongside my patient's clinical notes. If you need help to set this up, if you ask your PHO or your IT vendor to help with this, they'll be able to. At the beginning of a consultation, check if your patient is eligible for a cardiovascular disease risk assessment and whether you've recorded their blood pressure, blood lipid and blood glucose results and a smoking status in the last 12 months. If you have this information, you may need to just ask a few additional questions to be able to calculate their cardiovascular risk. If not, it's a great reminder to measure their blood pressure, ask them about their smoking status, and to print them a blood test lab form during the consultation. It can take a bit of multitasking, but it does become second nature. Additional pop-up boxes are also great for updating missing information quickly and should be designed to link directly to your patient management system. Most prompting tools can be tailored to suit your needs, so talk with your colleagues about what you most want from a prompting tool and discuss it with your IT vendor or PHO to set it up for you.
If you want to record data directly into your patient management system, there are some wonderful shortcuts that you can use. For instance, if you use a MedTech PMS, open the Classifications tab, select the right read code to record someone's smoking status, for example, current smoker, never smoked or ex-smoker. Another option is to start typing smoking or tobacco in the clinical notes field and then right-click the partial word to bring up the right read codes for you to select. When it comes to recording smoking advice, select from a list of read codes in the Classifications tab. To add a patient's blood pressure result, use the Screening tab. You can also type the blood pressure result in the clinical notes field after \BP entry, which will then directly transfer to the right field in your Screening tab. Use the History tab to update any medical history of relevance. If your patient has a history of cardiovascular disease, they won't need a cardiovascular risk assessment. Just type \CVR101 in the clinical notes field, which will directly transfer to the right field in your Screening tab. Alternatively, enter 35% as their risk percentage in the screening every year when you review their treatment plan. If there is a family history of heart disease, record this in the History tab too. And once you input blood lipids and HbA1c results that come back from the lab, a patient's cardiovascular risk percentage should be automatically updated in the Screening tab. If you want to do this manually, go to Screening, select New Entry, and then select CVD Risk as the screening code, and add the percentage you have calculated in the box. You can also type it in the Clinical Notes field after a \CVR, which will directly transfer it to the right field in your Screening tab. A diabetes diagnosis can be made if an asymptomatic patient has 2 results above the diagnostic cutoff. That's an HbA1c greater than 50, a fasting plasma glucose greater than 7, or a random plasma glucose greater than 11. This information is summarised in the New Zealand Primary Care Handbook. People with diabetes can usually be coded using either diabetes type 1 or diabetes type 2.
If you calculate that someone has a 10 to 20% cardiovascular risk, then you or someone in your team will need to discuss this with the patient and consider lifestyle options and medications. Make sure that the patient is well informed about their risk and promote their involvement in any decision making. People with a risk of 20% or more will need to be prescribed medication. This could be done in a follow-up consultation or in a heart health clinic run by your practice. If you opt for a follow-up consultation, the Heart Foundation's Your Heart Forecast tool is really helpful in explaining the results of the assessment to your patient. What this says here is that your heart age is 75. It's a visualisation tool that helps you communicate cardiovascular risk to your patients. It uses a dynamic graphical story showing their current and future cardiovascular disease risk and the benefits that lifestyle changes might have. The trajectory of risk can be a real eye-opener for patients. And we know that it can make a really big difference to patients when a health professional talks to them about their cardiovascular risk and what they can do to reduce their chances of having a future heart attack or stroke.